Chair, and thank you for convening this very important topic today. I'm going to ask some very succinct questions for Dr. Hoag to start. Dr. Hoag, do you feel that masks and using masks on kids in school stops the spread of COVID-19?
We're okay. So I think we need to look at the science that we have, and we need to admit that we don't have robust science or randomized control trials on this topic, but we have observational studies, one from the COVID response dashboard in Florida, not finding an impact of cloth mask mandates on teachers and students, and then from the CDC in Georgia, not finding an impact of cloth mask mandates on children in terms of disease spread. And so we need to recognize that masks may be providing a false sense of security or not potentially detecting the impact that they're having. So that remains an unknown until we have better studies. We have a randomized clinical trial from Bangladesh now that found surgical masking among adults to protect adults over 50 years old in the context of also increased distancing. But cloth masks in that study did not have any detectable impact in terms of SARS-CoV-2 rates in adults.
Dr. Hoag, do you feel that isolating and quarantining children affects mental health and increases mental health issues like anxiety and suicide in children?
Yes, I do. I believe that, you know, from what I have seen, that we've watched children a rise in the rates of mental health disorders coincide with keeping children in remote learning, and so children are by nature social creatures, and by disrupting this, we're taking a major chance with their mental health. So.
And finally, Dr. Hoag, do you feel that the large spike in BMI that we're seeing in children, especially kids ages 5 to 11, are we facing future long-term impact in pediatric health?
Oh, absolutely. So we saw a doubling of the increase of BMI among 3 to 11-year-olds. They were the most highly impacted in the study released by the CDC, and weight during childhood and obesity during childhood has enormous impacts on health later in life.
Thank you for those answers. I'd like to turn to Dr. Beers. According to data from the CDC, early in the COVID-19 pandemic, the total number of emergency department visits related to child abuse and child abuse and neglect slightly decreased, but the percentage of such visits resulting in hospitalizations increased in comparison to 2019. We've also seen reports of increased depression and anxiety in children and teens. Could you comment on the potential missed and unreported cases in these increases in mental health problems among children? And do you think that the rise in these issues can be attributed to the disruption of children in-person attending of school?
Yeah, so yes, thank you. These are absolutely things we're concerned about, and I do think that the lack of in-person school for many children was a contributing factor. It's one of many factors. I think it's important to recognize. It is why the AAP very early on in the pandemic, in our guidance, return to school guidance, said that we thought it was the highest priority for children to get back to school safely and to do that with layered mitigated precautions so that they could.
And thank you for making that statement clear that the American Academy of Pediatrics advocated for the rapid return of kids to school. Dr. Beers, you made a statement, and I share your concern regarding missed routine vaccines for kids. And I've been working with my colleague present here today, Dr. Kim Schreier, another pediatrician, in addressing that issue. And finally, in my remaining time, I really want to acknowledge, Dr. Beers, that your expertise as a pediatrician and as a president of the American Academy of Pediatrics is so important. But I also want to acknowledge something that some people might not know about you in this room, and that is your training at the Portsmouth Naval Hospital and your support of the United States military and their children at Getmo in Cuba, at the National Medical Center here in Bethesda. I worked at Portsmouth Naval Hospital during Desert Storm and Desert Shield, and I saw the hardworking military physicians caring for the children and caring for all the individuals there. I want to acknowledge that in the few minutes that I had remaining. Thank you, Madam Chair, and I yield.